Okay, good morning. Let's come to our topic. The topic is basic of metabolic disorder and skeletal dysplasia. So, what is the basic about the metabolic disorder and skeletal dysplasia? These two disorder. One is metabolic disorder and another one is skeletal dysplasia. So we will know the basic about this. The first point, composition of bone. So what are the things with which the bone is get composed? One is cells, second is protein, third is mineral, and fourth one is combination disorder. So in the cells deficient, Paget disease, osteopetrosis, and Brown's tumor. And protein get deficient in osteogenesis imperfecta, scurvy, and mineral in rickets and osteomalacia. And combination disease is osteopetrosis. Look at this picture. We will know more detail about this disorder later when we will do the separate topic. So what is trabeculae? These are composed of dense collagenous tissue, which are now present in cancellous bone. The bone is of two types, cortical bone and cancellous bone. Cancellous bone you will get where? Near the epiphyseal region. Okay. So these are composed of dense collagenous tissue. Here you will get dense collagen, densely packed collagenous tissue, which are now present in cancellous bone. So look at the photo, principal compressive group. There you will get principal compressive group. From there the force get transmitted downward, and another is principal tensile group. This one is compressive group and here is tensile stress, goes like this. So tensile group, greater trochanter tensile, this side tensile, this side compressive, and here we will have secondary compressive group. Primary is here, secondary is there, and this principal tensile group come downward as a secondary tensile group. Okay. So femur, in femur you will see compressive side of bone. Which side is compressive? Look at the red line, that is medial side, and tensile side of bone is lateral side, that is denoted in blue line. So medial side primary and secondary, and lateral side also primary and secondary. The fifth point here is along the greater trochanter. A healthy bone, all five groups visible on X-ray. All the five groups get visible on X-ray. So lumbar vertebra most commonly affected in osteoporosis. A neck of femur fracture also affected in osteoporosis and old age disease. So now let's come to topic rickets and osteomalacia. So these are disorder of mineralization. Okay? So rickets you can see where in children, and osteomalacia skeletally mature people. There you will get osteomalacia. So in rickets is a disorder of children occurring before physical closure, before the epiphyseal closure. before the physical closure. So what are the cause? The cause is vitamin D disorder, calcium deficiency, phosphorus deficiency. So calcium deficiency and phosphorus deficiency, these two will happen in children because of low intake. If you will take low calcium, low phosphorus, and increase renal losses. So rickets of prematurity, calcium and phosphorus deficiency. Okay. In clinical feature, what we will see? First site to be examined is a skull. What you will get in a skull? Craniotape. What is craniotape? Softening of a skull. A skull is very soft there in the rickets children. Parietal and occipital bone. Earliest manifestation. Parietal and occipital. This one is parietal bone, and here backside occipital bone. Earliest manifestation. Frontal bossing. Frontal bone looks like coming outside. Frontal delayed closure, and fontanelle it's not get closed. In chest you can see a ricket rosary in chest, that is painless costochondral prominence. It's not a painless costochondral, that is called osteoid A zone 4. And another feature, pectus carinatum, deposition of prominences of sternum. Carinatum. Harrison sulcus, you will get depression along attachment of diaphragm at subcostal margin. Shortening, short stature, long bone. Diaphysis, bowing, metaphysis, splaying and fraying. Because of that you will see widening and irregular metaphysis. In knee you can see genovarum, valgum, wind swept off leg. In hip you can see coxa vara. Muscular flaccidity, muscle weakness, tetanic occur, protuberant abdomen. Evaluation of patient, you can do serum calcium, phosphorus, vitamin D, that is decreased here. Serum alkaline phosphatase is increased, and the treatment is supplement calcium, phosphorus, vitamin D. Monitoring of response, radiological monitoring, appearance of white line around metaphysis on X-ray. Later I will see, give you time to see the photo. Can be seen within 1.5 months. Metabolic assessment, level of alkaline phosphatase. Initially level of alkaline phosphatase high. When mineral are supplemented, there is gradual decline in alkaline phosphatase. As bone become healthy, level of alkaline phosphatase normal in 1 to 2 years. To check if it is safe to operate on a child with rickets, alkaline phosphatase level should be normal. Prominent sternum, rickets rosary, splaying, fraying, wind shaped deformity. What is osteomalacia? Osteomalacia is softening of bone, presented in a history of minimal trauma leading to pain, fracture line surrounded by sclerosis, pseudo fracture, milkman line, and loser zone. You can see here. Sites are pubic rami, neck of femur due to pulsation of femoral artery, olecranon, lateral margin of scapula and ribs, protrusio acetabulae or otto pelvis.